Hello everyone, welcome back to my channel. Myself Dr. Akash, and today I am going to discuss about recent updates which are important for upcoming INICET exam. First in PSM, first update is Janani portal. It has been launched in 7th May 2026. It is the journey of antenatal, natal and postnatal care. It is a service-oriented digital platform designed comprehensively to monitor and maintain digital health records of women during their reproductive age. It has been developed as an upgraded version of existing RCH portal, and this platform creates a longitudinal health record by capturing key service delivery events across continuum of care. It aims seamless tracking of maternal and child health services. Next is Census 2007 mascot. Vikash and Pragati. Vikas is the male enumerator and Pragati is the female enumerator. It represents gender equality. It promotes pupils' participation. Next is CMMS portal, that is Census Management and Monitoring System. Next is Manav framework for AI. You can see the expansion of the acronym. The next is SAHI, Strategy for Artificial Intelligence in Healthcare for India. Both. It is the benchmark opening data platform for health AI. Next is Eat Right movement by Government of India. It has three pillars: safety, healthy and sustainable. Next is World Health Day 2026 theme. Together for Health, Stand with Science. Next is indigenous vaccine for malaria, that is Adfalcivax. And a new vaccine for dengue has been approved recently, that is Qdenga. Next is WHO TB regimen for drug sensitive TB. It is a 4-month regimen, that is 2 HMPZ and 2 HPM. H for isoniazid, P for rifampicin, M for moxifloxacin and Z for pyrazinamide. It is still not adopted in India. You can see the eligibility criteria, that is weight should be more than 40 kg and age should be more than equal to 12 years. Next is Mission AIDS Suraksha. Now it is 95 95 99 approach. Previously it was 95 95 95. Next is Daman. It is the malaria control program in tribal areas. And Hati, that is Malaria Elimination Initiative. So PSM is complete now. Next is pharmacology. All the drugs which has been recently approved, I have tried to compile. Let's start. First is Bevdegestrand. It is the new drug approved for ER positive, HER2 negative breast cancer. Next is Tradipitant. It is an NK1 inhibitor. It has been approved for prevention of motion sickness. Next is Brimonidine tartrate and carbachol ophthalmic solution. It has been approved for presbyopia in adults. Next is Suzetrigine, that is a sodium channel blocker, has been approved for acute pain. Next is Fitusiran, that is an antithrombin directed sRNA for prophylaxis in hemophilia A or B. Next is Nipocalimab, that is a neonatal Fc receptor blocker, and it has been approved for generalized myasthenia gravis. Next is Lenacapavir, that is HIV-1 capsid protein inhibitor. It has been approved for pre-exposure prophylaxis in HIV-1. Next is Brensocatib, that is dipeptidyl peptidase 1 inhibitor, and it has been approved for bronchiectasis, that is non-cystic fibrosis bronchiectasis. Next is Mitavipat, that is pyruvate kinase inhibitor. It has been approved in adults with alpha or beta thalassemia. Next is Nerandomilast, that is PDE4 inhibitor, and it has been approved in idiopathic pulmonary fibrosis. Next is Copper histidinate. It is a copper replacement therapy and it has been approved for Menkes disease. Next is Resmetirom. It is a thyroid receptor beta antagonist and it has been approved for MASH, that is metabolic dysfunction associated steatohepatitis, and it was formerly known as NASH. Next is baricitinib, that is JAK inhibitor, and it has been approved for alopecia areata. Next is tirzepatide, that is dual GLP-1 and GIP receptor agonist, which has been approved for obstructive sleep apnea. Next is a newer antibiotic, nafithromycin. It is a fourth generation macrolide, and it has been approved for hospital acquired pneumonia for various organisms. Next is vonoprazan, that is novel potassium competitive acid blocker, and it has been approved for GERD H. pylori infection. Next is cefepime in metazobactam combination, that has been approved for complicated UTI. Next is insulin icodec. It is a once weekly basal insulin analog. Next is orforglipron, that is oral GLP-1 agonist, approved for obesity recently. Next is navepegritide and vosoritide, that is C-type natriuretic peptide, inhibitor of FGF23, and it has been approved for achondroplasia. Next is paltusotine, that is oral somatostatin receptor type 2 agonist, and it has been approved for acromegaly. Next is etripamil nasal spray. It is a calcium channel blocker, and it has been approved for PSVT, that is paroxysmal supraventricular tachycardia. Next is aficamten and mavacamten, that is myosin inhibitor, and it is also a calcium sensitizer, and it has been approved for hypertrophic obstructive cardiomyopathy as a second line drug. Next is lerodalsibep, that is a PCSK9 inhibitor, and it has been approved for hypercholesterolemia. Next is depemokimab, that is IL-5 inhibitor, and it has been approved for severe eosinophilic asthma, and it is the longest acting monoclonal antibody for asthma. Next is difamilast, that is PDE4 inhibitor, and it has been approved for atopic dermatitis. Next is linerixibat, that is ileal bile acid transporter inhibitor, and it has been approved for cholestatic pruritus associated with primary biliary cholangitis. Next is joliflodacin and gepotidacin. Joliflodacin is topoisomerase 2 inhibitor, and gepotidacin is topoisomerase 4 and DNA gyrase inhibitor, and both has been approved for gonorrhea. Next is Vimkinua vaccine, that is approved for chikungunya. Next, clesrovimab, it has been approved for prophylaxis for RSV virus. Next is elinzanetant and fezolinetant. Elinzanetant is NK1 and 3 receptor inhibitor, and fezolinetant is NK3 receptor inhibitor. Both has been approved for postmenopausal hot flashes. Next is aceclidine. It is a cholinergic analog, and it has been approved for presbyopia. Next is imlunestrant, that is selective estrogen receptor downregulator, and it has been approved for breast cancer with ESR1 mutation. Next is aprocitentan, that is endothelin receptor antagonist like bosentan and ambrisentan, and it has been approved for systemic hypertension. Next is sopidonium, that is anticholinergic analog, and it has been approved for axillary hyperhidrosis as a topical application. Next is xanomeline, that is M1 M4 agonist. It has been approved for psychosis recently. Next is landiolol, that is shortest acting beta blocker, and it has been approved for acute rate control for atrial fibrillation. Next is lecanemab, that is humanized IgG1 monoclonal antibody that binds to A beta soluble protofibrils, and it has been approved for early onset Alzheimer's disease. Next is valoctocogene roxaparvovec. It is adenovirus associated vector based gene therapy, and it has been approved for severe hemophilia A. So pharmacology is complete. Now OBG. In OBG, first is PCO is now known as PMOS, that is polyendocrine metabolic ovarian syndrome. And second, torch infection is now known as scourge, that is syphilis, CMV, others, rubella, chickenpox, and HSV. There are so many updates right now, but I feel these are the most important things you need to know, or you may need to know for INICET. Tomorrow is the exam, so don't go for details of these updates. Just go through it once, so that the names can strike in your mind during the exam. So best wishes for you guys, and thank you.